Hey guys, thanks for joining me today. I just wanted to tell you guys about a really exciting opportunity I got this week. I have been observing these online conferences for National Accessibility Awareness Week. Reachability is an organization whose mission it is to connect people with disabilities to resources that can help them overcome their barriers. So it's really nice to see something like this, especially where they're taking advantage of the opportunities within this pandemic to make this conference more accessible for everybody anyways by having it exclusively online. So they got to talk about a lot of really interesting topics, and this conversation specifically revolved around having a disability during a pandemic. I think when we're all going through a worldwide traumatic event like this pandemic, it's really hard to take a moment and stop to consider those who are affected most. So the discussion started with a really good point about home care. And when it comes to home care, we already know that people who are living in long-term care facilities are having trouble reaching the level of care that they really need to live comfortably. But, there's not really much of a discussion around those who are living at home and need home care assistance. So if we think about isolation and we think about social distancing, then we're talking about limited access to care, limited resources. One of the difficulties is where you have basically a revolving door of home care workers. When you have multiple people coming in and you've got people who aren't quite as familiar, people who don't know your routine, I feel like it would be a lot easier to kind of get things done and address tasks that are needed to be done on a daily basis when routine becomes familiar. But when you have new people in all the time, then that makes it a little bit more difficult. There was a quote. They said, you need a backup plan to your backup plan. So folks with disabilities who are living at home, relying on home care, have to, be worried all the time about things being canceled last minute, or there not being people to provide that adequate care. There was one case study that one of the healthcare workers had mentioned where one of their clients was only able to access about 2 hours of care per week. In 2 hours of care, you're not considering the fact that there are a number of folks who, can't change their own clothes or prepare their own food. And when you have mobility issues and you're not able to attend to those things yourself. Not to mention, everybody's talking about picking up new hobbies or new activities while they're in isolation, but unfortunately there are people who, they just can't do those things by themselves, and when we're limited on healthcare, it becomes impossible for them. So then it becomes a mental health issue. And I really like the fact that they touched on mental health as well. It was really interesting to see them kind of like brainstorming ideas and coming up with ways that we can kind of move forward as a society. There was a big light shed on the fact that this pandemic, although detrimental to a lot of things such as basic health care, access to resources for those who require basic health care needs and home care, but also mental health care, it's really up to us to take into consideration that there are people out there who are kind of struggling and need that extra support and need that extra help. They also talked about the fact that schools being closed is another detrimental aspect of, the healthcare system during such a global event. There are children who rely on their school for access to nutritious food or healthcare. I know when I was younger, I had therapy through school, and I would not have been able to access it, nor would I have been able to afford it otherwise if I didn't get it through school. So there is limit on resources such as mental health care and things like food. So when you've got children who are kind of suffering at the hands of this pandemic, who aren't able to access health care, then that also becomes a mental health issue for the parents. Overall, it was really nice to see a conversation between all of those that are directly impacted by these worldwide events. You had a really nice mix of, doctors, therapists, home care professionals. There was a question right at the end that was really nice. It was, what do you dream of or hope of for the futures? And they mentioned a couple things here. So one was more mental health services for home care. So you've got people who are sitting at home and are getting, maybe somebody is getting adequate physical home care. They're getting adequate care for their physical and personal needs. But some of these people are not trained in mental health, some of these people are not mental health specialists. Another comment was we need to hear from the voices of those living with disability, and that one was really important. That one was super important because we want to hear from the people who need the things that we're trying to look for, need the things that we're trying to change. You want to be able to hear from the community themselves. I think what I loved most of all was the fact that they had mentioned that Reachability is looking to offer more remote workshops in the future. You know, instead of just simply shining a light on what kind of resources are inaccessible in situations such as a global pandemic, instead they're actually taking that and they're turning it into a positive by realizing what kind of services they can offer and what might be more beneficial to somebody. So for example, somebody who wants to be able to attend a conference like this, where the only possible way that they can actually attend it happens to be online. So it's really cool that, you know, that's the entire discussion right now is what's going on right now, what's bad about it, and then how can we turn this around and make it a positive? What lessons can we learn from this? So it was a really good discussion, and I can't wait to see the rest of the conference. I'm really excited.